Welcome to Go Vote Omaha, presented by the League of Women Voters of Greater Omaha. I'm Geri Simon, a League member and your host. Each program, we talk about issues that are important for elections. We hope to inspire you to talk about those same issues. And most important, when election time comes around, we want to help you be ready and willing to go vote. Our topic for today's show is the Transitional Health Insurance Program, better known as Medicaid expansion. It's Legislative Bill 1032. And to help us sort out the issues with that bill, we have two guests from Nebraska Appleseed. Welcome Kait Madsen, who's a community organizer for economic justice in the Healthcare Access Program, and the staff attorney for the healthcare program, McCleery. Welcome to you both.
Thanks
for being here. Let's start with you, Kait. Why don't you tell our viewers, what is Nebraska Appleseed?
Sure. So Nebraska Appleseed is a nonprofit advocacy organization that works on issues that impact a lot of Nebraskans. So we have four main program areas. We have a child welfare program, an immigrants and communities program, a healthcare access, and economic justice program. And then we take sort of a three-pronged approach to addressing issues in those program areas. So we do some policy work with lawmakers. We do a lot of community education and outreach work. And then we do some legal work as well. Okay. And tell our viewers about your background in Appleseed. Sure, yeah. So I started at Appleseed in September, and as the field organizer, I'm the one that does a lot of the community education and outreach, a lot of the sort of working to gain public support around issues that we're working on, and then I work with people who are directly affected by some of the issues that we work on as well. Okay, so you work a lot in Lincoln and also Omaha and then throughout the state. I do, yeah. Mostly in Lincoln, some in Omaha, then I also do some traveling across the state. Okay, great. Mm-hmm. And now we'll go to Molly. Molly, you're the staff attorney, so tell us about your background.
So I've been at Appleseed for about 3 years now. I work in our healthcare access program, which the mission of that is to ensure that all Nebraskans have access to quality, affordable healthcare. So LB 1032 is a big priority for us. As Kait mentioned, I do a little bit of each of our three-pronged approach. So I do work on litigation or courtroom work, some policy work, and then also community education. Okay. Well, let's get right down to our topic. The League of Women Voters and Appleseed support expansion of Medicaid for Nebraskans. And we have about 77,000 people who are without, who've fallen through the gap without health insurance. Tell us why we need this expansion in Nebraska. So as you mentioned, we have 77,000 people who currently do not have a path to health insurance coverage. When the ACA was passed, it was intended that everyone would have access to coverage either through their employer, through buying a private plan on the marketplace, or through a public program like Medicaid or Medicare. The Supreme Court in 2012 made it an option for states to extend the Medicaid program to cover low-income parents who make too much to qualify for Medicaid, but not enough to purchase exchange plans, or childless adults who, no matter what their income is, are ineligible for Medicaid. So we have a lot of people that kind of fall into that gap, as you mentioned. And as a state, we want to make sure that everyone has health care, because when Nebraskans are healthier, our economy is healthier, and it ensures we have a strong workforce, and it has a lot of impact in a lot of different areas. Okay. What has been the experience with other states? Are we in the minority of states expanding it, or what? Explain that to our viewers. So 32 states have expanded Medicaid, so we're actually in the minority of not doing it. Okay. And more states are talking about it. This option's been around since 2013, and so each year there are a few more states that look into it. As we're getting further from the beginning of when these programs started, we're seeing really positive results from states that have expanded Medicaid coverage. In addition to dramatically reducing the number of uninsured people in a state, we're also seeing great economic benefits for states that take this up by bringing back tax dollars to the state to invest in the healthcare system, and that when people aren't having to file bankruptcy or spending a lot of out-of-pocket money on health coverage, they are able to spend that money in their communities. Okay. And we've had several tries at passing an expansion in Nebraska. This is about the fourth iteration, I think, yes, of doing that.
And this time, LB 1032, introduced by Senator McCollister, takes a little bit of a different approach, and is actually using the Medicaid dollars to purchase insurance in the private market. So why don't you explain, and modeled after, somewhat after the plan in Arkansas, which has become a little controversial with some people. Why don't you explain to us what the approach is with this particular plan this year?
So this plan really draws on a lot of elements from different plans that in a number of different states. So as you mentioned, it looks at some things that have been done in Arkansas, but also New Hampshire, Michigan, Indiana, Montana. It's kind of the best of all of the plans out there, I think. So what it does is, as you mentioned, it allows for using Medicaid dollars to purchase private insurance plans. So the majority of people that enroll in this program will have private insurance coverage. Other people, if they have an offer of employer-sponsored coverage, so if they could get insurance through their job and their employer would pay at least half of that, the price of that coverage, they could get assistance with Medicaid dollars to enroll in their employer plan, so they could be part of their employer plan. Other people, if they have chronic health conditions or higher health needs, would be enrolled in Medicaid. So depending on your personal situation, you might be in a different plan. There are also elements of personal responsibility, which is something that a number of senators have mentioned that they've been wanting in a plan in the past. So there's a 2% contribution from most enrollees will have to pay 2% of their monthly household income to enroll or participate in the program. There's also a focus on primary care and making sure that healthcare is integrated for people. So making sure that everyone's providers are speaking to each other and that they have kind of a holistic approach to care. And then lastly, one thing that has been kind of popping up in a lot of states and what we've heard senators speak about is the need for some sort of workforce development component in this bill. What we know is that the majority of enrollees in this program, or the majority of people who would be eligible for this program, are working. But they're working in low-wage jobs that don't always have insurance coverage. They're working in retail or restaurant work or as home health aides, things like that that just don't provide insurance. And so this program creates a sort of sub-program that really is innovative and looks at some really kind of cutting-edge approaches to adult education and skills training. So it looks at what the in-demand industries in our state are. What are the jobs that employers want to hire for, but they can't find people to fill those jobs? And then looking at who wants to improve skills and kind of maybe move into a higher wage job and making sure that folks have those opportunities.
So that would be funded through 1032?
Yes.
And is any other state doing this kind of workforce development?
Not in this way. I think this is a program that really builds on a lot of the priorities that the legislature already is working on. So working on adult career pathways and skills training and trying to make sure that when we're educating folks and when we're giving educational opportunities, they're for jobs that exist and jobs that pay a living wage that can provide for a family. Mm-hmm. And so I think this program is really kind of integrating all of those best practices.
Okay. So that takes us to why do we think that this plan has a better chance of passing than any of the 3 previous plans? Why don't you talk about that a little bit?
So this plan is, as you mentioned, the bill is sponsored by Senator John McCollister of Omaha, and it really came out of LR 306, which was the interim study this past summer and fall that Senator McCollister also sponsored. That interim study was really an examination of what Nebraska's options are in terms of Medicaid expansion. So what are other states doing? What do we want to do here? What do we not want to do here? Let's just get all the options on the table and talk it through. And so Senator McCollister had 2 listening sessions with senators in Lincoln where everyone came together over lunch and just talked out what they would like to see in a bill, what they don't like to see, what their concerns were. And then after that, there were 7 listening sessions across the state in various communities from Omaha to Scottsbluff.
Okay.
Talking to healthcare providers, community members that would be impacted by this, and senators in their districts. And so all of those ideas really formed the foundation for what is in this bill. And so it really takes into account input from those who would be voting on the bill. And it also, as I mentioned, we're 4 years into states being able to do these programs.
Yes.
And we know what has worked and what hasn't worked in other states. And so selecting elements of the plans becomes a little easier when okay, other states have not had good experiences with that. We don't want to put that in our plan. So I think the conversation is different, and a lot more voices were at the table to sort of develop the plan, but also I think it's bringing into account voices from both sides of the aisle.
Okay, that's great. Well, let's talk a little bit about some of the criticisms of the plan.
Yes.
Some of the critics of the plan claim that the Arkansas plan, which this is modeled on, one of the plans it's modeled on, and that's been in effect since 2014, that it's not working in that state. And they say that's a reason that Arkansas is going to be getting rid of the plan that they have for expanding Medicaid, that did expand Medicaid in that state at the end of this year. And so why would they say that? Why is Arkansas not working?
So there's been a lot of discussion about Arkansas, and I think a lot of what has been said is really misleading. If we look at the experience of Arkansas, we see that it's actually been really successful. What a lot of the press around this and a lot of the things that have been said, it leaves out the important component that Medicaid expansion will continue in Arkansas. It just might look a little bit different. And so whenever a state does a waiver plan, so if you want to expand Medicaid, you have two options. You can either do what's called a state plan amendment, which is every state has a Medicaid state plan, and you can either check the box and say, we're going to cover this population as we intended under the ACA, we're just going to cover them, use Medicaid dollars, simple. Or if you want to start doing some of these state-specific approaches, like using private insurance or putting in work or premiums or anything like that, you have to do a waiver. And those are by their nature time-limited. They're 3-year demonstration projects. You have to prove a theory and kind of do more of that. So Arkansas did a demonstration project that was only approved for 3 years. And so it was intended to expire in 2016.
Okay.
The legislature passed a bill clarifying, yes, it will end in 2016, and if we don't renew this or don't come up with something, we will not continue the program. So basically reiterating what the waiver had said. The Arkansas legislature also appointed a task force of people of both parties to look at the issue, see what the state should do. They hired a very conservative consulting group who examined their entire Medicaid program, including the expansion, came back and said the economic impact of not doing this would be huge. You should continue doing this, but maybe make some tweaks. And so that was the recommendation. The governor supports that recommendation. The task force supports it. All signs point to it's going to continue, but just with some modifications.
Okay, so the people who are saying Arkansas is scrapping this plan, they don't quite tell the rest of the story that you just gave us.
Right, yeah.
Okay.
They did a lot of sort of complicated things with health savings accounts and things like that they realized didn't work. And that's sort of the beauty of doing these state-specific approaches, is that maybe things don't work out the way you wanted, you can try something different.
Okay, and you mentioned waiver, so if LB 1032 passes, Nebraska then would have to apply for a waiver with the federal government? Okay.
So you have to, as I mentioned, you have to put a sort of a theory together as to what, the federal government just doesn't give you a bunch of money and say, do what you want with it. You have to say, we're testing this theory, that's why we're going to kind of break the Medicaid traditional rules and do something different. So this bill is really looking at, if we provide folks in this coverage gap with insurance and opportunities to advance in the workforce and things like that, what are the rates of people transitioning into private insurance? And that's why it's called the Transitional Health Insurance Program. So if folks have insurance and they have health coverage, are they more likely to transition off of public assistance programs and into sort of the private market? And that's an approach that no other state has taken at this point.
Okay. Well, you mentioned money, so
Yes.
let's talk about the question people have is what's this going to cost the state of Nebraska?
So at this point, we're in sort of a tricky situation in that there is not a fiscal note out for the bill. It's highly unusual that you would have a committee hearing on a bill or any debate on a bill prior to the fiscal note coming out. What we saw was at the hearing on February 10th, the fiscal office received the data and information from the agencies to which they take into account in putting together a fiscal analysis of how much a bill would cost the state. They received that information pretty late in, were unable to put together a fiscal note prior to the hearing. So we are still without an official analysis of what it would cost. There is a report that was put out by a consultant hired by the Department of Health and Human Services that did some projections on numbers. However, that's not the report that legislators make use when making decisions. They use the Legislative Fiscal Office report. They're an independent body. They are not partisan, and they can take into account agency projections or reject them. They're kind of their own body.
And every bill has a fiscal
Yes.
note to go with it.
Yes,
Okay.
even if a bill costs nothing, you still get a fiscal analysis of it.
Okay. So it's not going to get a hearing in committee then until that fiscal note has arrived.
The committee hearing happened on February 10th. The bill won't be voted out of committee until that comes out. And it won't have a hearing on the floor of the legislature until the fiscal note is out either. So,
Okay.
But we anticipate that any day now, it should be coming out.
Okay. And then the next step would be, since it's a priority bill of the committee, the Health and Human Services Committee, then it would get the first hearing on the floor of the unicameral.
It should get they are already having some hearings from carryover bills from last session, but it will be heard on the floor.
Okay.
Yes.
We did talk about the HHS report that was widely reported on, I think, in the media about how it said it was going to cost a whole lot more to do this. And could you talk a little bit about that? Some people are saying there are some flaws in it. For example, it didn't take into account savings that the state would have from expanding Medicaid, which a lot of other states have found that they have had savings from expansion.
Yes. So. Each of the previous years, the Department of Health and Human Services has also hired an actuary to do some projections on what the bill would cost. And I think with this bill, as you mentioned, with this report, there are some concerns. Anytime you're doing an actuarial report, and you're especially doing a report over 10 years of cost projection, you're making a lot of assumptions. And I think you could disagree with some of the assumptions that were made as to the cost, as to participation rate, and things like that. And that's why the Legislative Fiscal Office's note is really what should be taken into account at this point. Yes.
Okay. There was another figure from the report. We keep talking about 77,000 approximately Nebraskans have fallen through the gap and don't have coverage. And this report said, oh no, it's more like 124,000. So can you talk about where did that figure come from in this actuarial study?
So the 77,000 number came from the Legislative Fiscal Office, I believe last year. And what they do is they look at the total number of eligible persons, so everyone in Nebraska that would be eligible for this program, and then they set it with a participation rate factor because not everyone that's eligible for a program will enroll in the program. And so that's how they get the 77,000. This number from the Optimist report or the DHHS report assumes that a lot more people will participate. So they assumed that that participation rate factor was a lot higher. They also assumed that a number of people, when they heard about the program, that are currently eligible but not enrolled in Medicaid would enroll in Medicaid. I think that is questionable whether that would be so high. We have not seen that historically in our Medicaid program. That was something that the legislature budgeted for with the ACA. They thought, okay, if we're out there talking to people about how everyone should have insurance, we're going to get a huge boom in our Medicaid program. We actually decreased in enrollment. So I think some of those projections in terms of participation are a little high.
Okay. And why don't you talk a little bit about, in terms of the dollars, the federal dollars that would come to Nebraska, and explain how it's basically you're getting all of the cost of expansion covered in the first few years. And so why don't you tell our viewers how that works?
So the ACA was set to be budget neutral, or Medicaid expansion was set to be budget neutral. So it is paid for through a series of revenue raises, so tax increases, and then also cuts to balance it out. So regardless of whether we take up this option, we're paying for it. I think that's the first thing to think about. We're paying for it through a number of different taxes, like taxes on indoor tanning and things like that we've been doing, and we are also experiencing some of the cuts. So that's the first thing to think about, the federal dollars. The federal match for this program is higher than what we would traditionally get for Medicaid. So Medicaid, traditionally, the federal government pays at a 60-40 rate, or 50 to 60%. So the state covers 40 to 50% of the costs. The federal government pays 50 to 60% of the costs. It's all depending on how this formula and how well our economy is doing. And I don't want to explain this really complicated formula to you, but
Okay.
So with Medicaid expansion, the federal government pays at the minimum a 90% match, and the state would only have to contribute 10%. So it started at 100% and then gradually sort of ratchets down to 90% at its lowest in 2020.
Okay.
So it's an incentive for states to take it up because there is that very significant increased matching rate.
Okay. And then that sort of leads to one of the other criticisms that you hear used against expanding Medicaid, which is, well, we can't rely on the federal dollars being there for Medicaid expansion. Mm-hmm. And I guess I think about, we have federal dollars that we use and we rely on for transportation and for highways, and so what makes Medicaid federal dollars different?
So you're right, 32% of our state budget is actually federal funds. And that includes Medicaid, but it also includes things like roads, education, parks, a number of different things. What makes Medicaid funds different is actually, I would consider it a safer investment. 32 states, as I mentioned, have taken up this option. So 2/3 of Congress are in states where they're receiving these dollars. So I think that makes it a safer bet in that Congress wouldn't probably vote against its own interests. The funding formula is written into statute. It would take an act of both houses of Congress and a presidential signature to change that. It's not a formula, it's in statute. This bill also includes a provision that if the funding for whatever reason drops below 90%, the program terminates immediately.
Okay.
So there are safeguards in place.
Okay. Now, I've heard from at least one place, person talking about saying that the Medicaid dollars are already being cut. And when I tried to get more specific information, it was, it's completely across the country that the dollars aren't there as promised. So what can you tell me about that particular argument?
I have not heard that in a reputable way. I think what we've consistently heard is that since the beginning of Medicaid 50 years ago, the federal government has never backed out of its promise to fund it at the level that it has said that it would fund it. Okay. There are places in our budget where we're not drawing down the max amount of federal dollars that we could be. So we're choosing to fund things with state-only dollars that we could be getting a federal match. Mm-hmm. That's not the federal government's choice. That's a state choice to not do that.
Okay. Well, on a positive note, tell us about some of the research that's been done that shows that this would be good for Nebraska.
So we've had two local reports put out, one from the University of Nebraska Medical Center a couple of years ago that looked at the impact of Medicaid expansion on the state, both from a public health perspective and then some of the economic benefits. That's a really great report. And then it was expanded on from two professors at the University of Nebraska, Kearney, who really looked at the economic benefits of this and found significant impacts to our state budget, both in reducing bankruptcies, 10,000 sustained jobs, huge amounts of money just in our communities that people would be spending on their town square. So I think those are good resources.
Okay. Then this particular bill seems to have a little bit more bipartisan support and support from business leaders. Why don't you talk a little bit about that?
So as I mentioned, Senator McCollister has been really good about meeting with lots of people on this, getting lots of input from different voices that we haven't necessarily heard in the past, and has really been working on connections in the Omaha business community. And we've seen some of the press around that with some leaders coming out publicly and saying, you know, this is something that would be beneficial for our business community. I think as we continue, we'll hear more support from some of those more unlikely voices.
Okay. Well, thanks so much.
Yes.
Kait, why don't you tell us a little bit more about where our viewers can get more information about LB 1032, about how to contact senators, and about Appleseed?
Sure. So a really good way to get more information is we have a website called insurethegoodlife.com. And you can sign up for a weekly newsletter that we send out there with legislative updates, volunteer opportunities, upcoming events, relevant articles. So you can sign up for that on there. And there's also information about the bill and some of the stories of people who are in the coverage gap. And then for contacting senators, contacting your state senator is probably the best thing you could do right now. A phone call, even after hours, a voicemail is great. An email, a handwritten letter, an in-person meeting, all of those are wonderful. And then also submitting letters to the editor to local media is really great as well.
Okay, great. Thank you so much, both of you, for being here and talking about LB 1032. For the League of Women Voters, I'm Geri Simon, reminding you to inform yourself about the issues, talk to others about them, and when election time rolls around, go vote, Omaha.